Good morning, I'm Dr. Kerry Chant from New South Wales Health with the COVID update for Sunday the 2nd of January 2022. Across New South Wales, we've got 95% of people aged 16 and over have received a first dose of COVID vaccine and 93.6% have received 2 doses. And of people aged 12 to 15, we've got 81.5% have received a first dose and 78.2% have received 2 doses. We currently have 1,066 COVID cases admitted to hospital, with 83 people in intensive care, 24 of whom require ventilation. There were 18,278 cases of COVID reported in New South Wales in the 24 hours to 8 p.m. last night, and more than 90,000 COVID tests were reported during that period. As we've previously indicated, it's important that we just don't look at day-to-day case numbers. It's important that we look at the trends in those case numbers. Some of the test results from today will reflect testing done over previous days, and when we analyse the data by test date, that will give us better understanding of the trajectory. So continue to follow those COVID-safe practices as you move around in this wonderful new year weather. Sadly, New South Wales Health is today reporting the deaths of 2 people, a man in his 80s from southwestern Sydney and a man in his 90s from Western Sydney. Both had received 2 doses of the vaccine. It is critical that we continue to get vaccinated, even at those high vaccine coverage levels of 95%. It still means there's 5% of the population that even haven't commenced vaccination. So please, I urge you to book in for your first, book in for your second if you're due, and importantly, book in for your boosters. We know that having the booster dose, it will improve your protection, particularly against the Omicron variant, and it's critical that we protect people, particularly those that are elderly and those with underlying health conditions. But I do urge everyone who is eligible, and people aged 18 and over are eligible for a booster after receiving their second dose. So please book online and get a booking as soon as you can. Over the next few days, access opportunities should increase with GPs, pharmacists. Our clinics have been operating throughout this period. So please, it is easy to book online, but if anyone you know is having trouble, please help them get that booster shot as soon as possible. New South Wales Health has also been updating its fact sheets. I know it's been a period of change where there's been lots of messaging, and so to help people understand the current settings and expectations, we've updated a fact sheet which is called Information for People Exposed to COVID. And what it attempts to do is to explain what your obligations are, but also give you information about what your risk of certain exposures are in terms of your likelihood of catching COVID, and then describe the actions we're recommending that you take. Some of them are required actions and some of them are recommendations that you take to protect you, your loved ones, and the broader community. So at the moment, we're focusing on our highest risk of catching COVID, and this means that whereas in the past you might have expected to receive a call or text, it's most likely that you will be notified by a friend, a colleague, or a workplace person you work with that you've been exposed to COVID. And so we do want to support you to understand your risk depending on the nature of contact that you've had with that individual. We give some scenarios in this fact sheet, so I do urge everyone to just familiarise themselves with it, but I'm just going to have a go at running through. What we're asking everyone in the community to do is watch for symptoms. So we really want people with symptoms to get tested. That's the highest likelihood that you've got COVID. We know that anyone in the household is at a very high risk. And so anyone that lives in the household with someone who has COVID is required to self-isolate for the 7 days from the last time you had contact with the COVID positive person. We're urging you to get a PCR test as soon as possible. And the reason for that is that by the time when you've got COVID, you're most infectious before you've got symptoms. And then obviously someone will go along and get a test. And then by the time they've had that test, even if they've been self-isolating, they've been exposing you when they didn't know they had symptoms in that 2 days before they had that symptom. And so by that time, you're likely to test positive if in the household, because we know that household-like contact is quite likely to transmit. So please go, if you're a household contact, you are required to self-isolate, but we're also urging you to get a PCR test and then a RAT test at day 6. And if both of those are negative, you can go about your business, but we do ask that you don't visit high-risk settings, healthcare, aged care, disability or correctional facilities for the next 6 days. So if you can avoid those facilities, please do, because you're still at risk for the further 7 days of acquiring COVID from that exposure. There are other circumstances where people are at high risk of exposure from COVID, and I'll just give you some examples of what we would talk about in that high risk. So if you actually spent some overnight, you might not normally live in the household, but you've spent overnight in the house with someone who's subsequently diagnosed with COVID and was infectious at the time. If you're caring for some children, you spent all day with the children, minding children of a friend or family member, and those children turn out to be positive for COVID, then that's sort of a high risk because it's very much like a household-like exposure. If you spent the whole evening with someone indoors, without masks in a household residential setting, again, that's a very high risk setting. So we're saying that self-isolation for 7 days from the last time you were in contact with that person is the most effective way of protecting others. Again, having a PCR test is very useful because of that very close prolonged contact, and also again having a rapid antigen test at day 6. Again, just being careful and cautious for that ongoing 7 days. And then there's lesser levels of exposure, what we call sort of moderate exposure, and that's where you've probably sat at a cafe having a meal with someone, socially distanced. That sort of fits into the moderate category. And then finally low, then that's where you've probably had distance contact, you've been outside or sitting outdoors, you've gone for a walk with someone, socially distanced outside. These are all sort of lower risk. And also if you've just got that Service New South Wales app alert, that means that there's been probably a case in a setting where you've visited. And again, the message there is monitor for symptoms, and if symptoms occur, get a PCR test immediately. So that fact sheet also provides advice about how you can manage the risk. So I do urge everyone to familiarise themselves with that. And there are also some supportive documents that if you're diagnosed with COVID, about the care and actions you can take if you test COVID positive. Again, I just want to thank the community for your continuing efforts to get vaccinated. And I want to also thank the community for taking those really practical steps to keep yourself and your loved ones and the broader community safe. It's so pleasing to see people wearing the masks indoors. It's so pleasing to see that social distancing. It's so pleasing to hear the stories that people have chosen to have the barbecues outdoors or had the dinner party on the veranda. So all of those very practical, safe choices people are making. I just want to thank the community for doing all they can, but also enjoying this time of year with the beautiful outdoor environments, the weather we have at the moment. Please keep outside as much as you can. And if you're socialising, keep those gatherings small. And also just support we just want to make sure that we protect the vulnerable. So please do not go and visit aged care facilities or any high-risk individuals when you've got symptoms at all. We just really need to make sure that people with symptoms stay at home, get tested, isolated as a key preventive going forward. Thank you.